When an athlete suffers an injury, comprehensive assessment and initial injury management are crucial to improving outcomes. At the Children's Healthcare of Atlanta Sports Medicine Program, pediatric-trained physicians and staff collaborate to manage all types of sports injuries, from minor ankle sprains to CL tears.
The Children's Healthcare of Atlanta Sports Medicine Program wants to be a resource for all of the young athletes and their families in this community. We've provided care through surgical and medical interventions. We provide care in high schools and numerous club sports throughout the metro area so that the kids of this community can have the best care possible to treat not only injuries that have happened, but in a preventive measure so that we can stop injuries from occurring. We have physical therapists on our staff. We also have several staff members that are certified strength and conditioning specialists. We also have a dartfish analysis program that videotapes kids when they're doing different types of sports activities, whether that's jumping, throwing, and it can pick up mechanical flaws and help train the kid for different types of exercise programs or whatever it might be that will help improve their performance and prevent injuries.
Each year, the Children's Sports Medicine Program treats over 3,100 new patients, translating to more than 25,000 patient visits. Physicians can send injured athletes to the sports medicine physical therapists for assessment and treatment. In doing so, we carefully assess the extent of each injury and quickly determine how to care for it.
If I push on that bone, how bad is that?
Our individualized assessments are based on the maturity, skill level, and performance goals of each athlete.
Each patient that comes to the door gets a thorough 60-minute, give or take, evaluation where we try to look at them as an individual and look for their deficits, look if it's a range of motion deficit, if it's a strength deficit, if it's a balance deficit, coordination. Then we try to take those deficits, address them through exercise, manual techniques, whatever specifically they need, and we try to tailor it as well to the sport they play. So the exercises they're doing can mimic as best we can the stresses and strains of their individual sport. So when they're ready to get back to their sport, they can do it successfully and not get re-injured.
I came to Children's Healthcare because I tore my ACL and my meniscus in my left knee during a high school soccer game. I've been doing a lot of leg presses, weightlifting, I've done a lot of squats and balancing kind of stuff to fire the muscle and get it strong again.
The Children's Sports Medicine Program offers rehabilitation services for many sports-related injuries, including knee injuries, such as ACL tears, fractures, sprains, strains, dislocations, and overuse injuries.